Hey Coral Springs, it's Dr. Maan here. Just wanted to give you guys an update on what's going on. We've really changed a lot of procedures and protocols here in our office, and we want to make sure that you understand what you're going to be walking into. We ask that if you're having any symptoms, been exposed to anybody who's having symptoms of the coronavirus, to stay at home and seek medical attention. We'll be posting information to the Boulevard Virus Helpline, so that way you guys get some information. Once you come for your appointment, you'll see our front door over here. We have a nice little pink sign here that talks about some things, some questions that you need to really ask yourself. And I'll read these out for you guys. Do you have any fever that's over 104 degrees or higher? Do you have a new cough that you can't attribute to any other health condition? Are you having any shortness of breath? Do you have a sore throat? Or do you have any other aches and pains that's not related to your back or your neck? Like if you just woke up and you're feeling stiff and sore. If you answer yes to any of these questions, we ask that you don't walk in. And actually, we have our phone number posted here. You give us a call or text us, and we're inside. I'll hop on the phone and talk to you guys and make sure that everything's good. So we want to make sure that we're not exposing you to any harm and making sure that you don't expose others to any harm. Let's come on in. I'm going to show you the next step. Again, we have the same sign posted here, so just in case if you missed it, you have it here as well. Before you do anything, you sign in or anything like that, Marlene or Sarah will be here up front. They'll go ahead and ask you these questions. Make sure that you read the sign. After that, they're going to go ahead and take your temperature. This is a cool thermometer that we have. We just turn it on, and this thing resets to 0, and we actually place it right onto the temple, so nothing's going into your mouth. There's nothing that's being transmitted or anything like that. And then this takes about 2 seconds. It gives a little beep. And then we go ahead and see I'm running a 97.4, which is good. We're of concern if we're hitting triple digits, anything over 100 degrees. After you're done with that, we have pens here that have been sanitized. Nobody else has used them. They've been clean. We go ahead and sign on in. Once the pen's put down, Marlene or Sarah will grab that pen and go ahead and sanitize it for the next person. Then before we start anything else, we have you go into the bathroom to wash your hands. So come on, follow me. You can see our bathroom. Our bathroom, as you can see, we have a lot of cool things here to help protect our patients and everyone else. We have some Clorox wipes here. This is disinfectant wipes. It's made with bleach. And we have some Lysol spray, and then we have other canisters as well of Cavicide and other cleaners that will help clean everything. Also, our toilets and sinks and handles are cleaned after every patient. For your protection, we also have these toilet seat covers that are here that you can use. We have plenty of toilet paper, and then we also have soap here. I'm going to show you what's the right way to wash your hands. You grab some soap. We have some water that's turned on, and you're supposed to get enough soap on your hand to cause the soap to kind of bubble up, and you're supposed to wash your hands inside and out into every groove and crevice, and you got to do this for about 20 seconds. I like doing it for 30 seconds just to make sure I got everything done. And then you go ahead and you rinse off all of the soap. And then we have disposable paper towels from this dispenser, so not everybody's touching them. They come out one by one. You go ahead and clean your hands, dry them off. And while you still have the wet towel, go ahead and use that to go ahead and turn off the water. And then we have a little kickstand here. The trash can comes up, and then we can go ahead and throw it away. After this, then we go ahead and take you back into our room, so that way you guys can see how we take care of the room. Guys, we're in our rooms. The rooms get sanitized after every patient is done with it, so that way it's already cleaned. This table is already cleaned for us after we were done seeing the patient, but for added level of security and making sure that you guys see it as well, before the patients go down, we go ahead and spray another layer of this disinfectant on. We have various types of disinfectants that are chlorine based, alcohol based, things that the CDC recommends. And then we kind of leave this on. Now I'm doing a quick here just for the video to show you, but normally when we put on the disinfectant, we let it sit there for about 30 seconds to a minute, depending on which disinfectant we use, so that way it has time to activate. We wipe it off, and every time we're using gloves, I'm wearing gloves as well when we're treating patients. And then for added level of security, we have this face paper, so that way your face is not making contact with any of the surfaces anymore. After this, we would do a treatment on a patient, finish up with therapies, and then once we're done with the rooms, Marlene or Sarah comes in, goes ahead and cleans everything, and this ensures that we're sanitizing and making sure that the office is safe for everyone here. Again, if you're having any symptoms, call the Broward virus hotline or seek medical attention. But if you're having any back pain or neck pain without the fever symptoms, then it's very important that you see a chiropractor and not go to the emergency room or urgent care, where you would be coming in close contact with people with the virus as well. If you have any questions, contact our office. Make it a great day, Coral Springs.